Glad to have you back. Next segment is on dental emergencies. Now, of course, dental emergencies can occur through a number of different types of actions let me start over. Hi there. Thanks for joining us for our next segment. We're going to talk about dental emergencies in this segment. Now, dental emergencies, of course, are going to involve any of the teeth that could potentially be knocked out or compromised in some way through some activity. How do we avoid these types of injuries? Well, you could consider a mouthpiece. So you can get a mouthpiece that can be dipped in slightly hot water and bit into to form the shape of the teeth. And mouthpieces can greatly reduce injury to teeth and things like that, especially in certain activities like skateboarding or riding bikes. Maybe you might even consider that, especially in certain situations. But some things where your scooters are real bad too. You have to watch those scooters too, the 1-foot scooters. But whenever somebody knocks a tooth out or compromises it in some way, it's not necessarily serious enough to call 911, except when there's a lot of blood loss and other tissue that may be damaged, or you think there's a head or neck injury that's involved. In those situations, you would call 911. But if you think it's a simple dental emergency, meaning there's been a chipped tooth or there's been a tooth that's been completely knocked out, root and all, we can deal with that generally through the dentist office. But we need to know some steps after prevention, need to know some steps to take if they do occur. Now, if you chip a tooth and the crown remains, there's not a lot the dentist, the part of the crown remains, there's not a lot the dentist can do except either grind the tooth down to be smooth or sometimes shaped for an artificial crown or artificial cap. But if the child or the patient knocks a tooth out, root and all, and I think we've all seen teeth with their roots attached to them, they can be reimplanted by dentists. The younger the situation, the better. When you get my age, you're not going to have much luck. About the cutoff's about 40, 45 years old. Teeth can be actually reimplanted if they're not compromised and there's not any damage to the bone structure of the mandible or the jawbones there. So in those situations, here's the treatment for it. Number one, we've got to control the bleeding if there's any large amounts of blood loss. There's a lot of capillaries running around the mucous membranes of the gums. So if they're compromised a lot, we're going to have to control the blood loss. And the first way that we're going to do that, some people think it's best just to have them, spit, but there's 2 steps involved in that. Before you spit, you have to actually suck, and by the sucking action, you're just making the blood continue to be released, and there's not any clotting going on. So what we do in that situation is take a piece of gauze, and you want to form it into a square or a rectangular shape that's slightly larger this way, lengthwise, than the teeth that are missing, slightly larger, and also slightly longer. And you can also take pieces of gauze, if it's not enough, and stuff a little bit more in there. But we want to very, very gently, with our thumbs, and the gauze being slightly larger this way, slightly longer this way, gently push it into that area where the teeth are missing. And have the patient bite down very gently on the gauze. That provides direct pressure, and it provides a much safer ride and probably much quieter ride to the dentist office, because you have to tell them to keep the direct pressure on. Just keep your mouth shut and keep the direct pressure on. We do a lot of dentist office when we do CPR and first aid training. And most dentists that we've talked to said that there's a range. They'll say, if you get them there within 4 hours or so, we can reimplant the teeth. Or if we get them there within 8 hours, during that day, we'll get it reimplanted, and it'll probably take. But the first step we're going to take is to control the bleeding by that direct pressure. And the next step we're going to take is simultaneously, hopefully, is to go ahead and pick up the tooth. Now, let's not pick it up by the root, because if we pick it up by the root, or the part that goes down into the gum, and we could introduce bacteria to it. So it's best to pick it up off of the ground or the area that it's on by the crown, or the part that we see exposed in our mouth. And we'll pick it up by the crown, and put it in a cup of milk or water. That keeps the tooth hydrated. And it's important to keep the tooth hydrated so it's viable, so the dentist can reimplant that tooth. Now, I know this sounds kind of, kind of gives you the EBGBs if you think about it. Going into the dentist office, they'll numb you up and they will actually twist the tooth back into the jawbone. And then they will potentially, hopefully it's not any gum damage, but they will usually attach the teeth, temporarily bridge the teeth to permanent teeth that are not compromised. And in that situation, after about 2 or 3 months, young kid, a lot of times they can take that temporary bridge off and that tooth is as good as new and just like it never fell out, sometimes even better. As you get 45 or 50 and older, it doesn't work as good. We're just not as resilient. Our gum tissue does not regenerate as fast, and of course our bones are all fully developed and don't get to the calcification phase as strongly as a child's would. So in that situation, we can save those teeth, and it's a whole lot better than false teeth or dental implants or something like that. And make sure to take the tooth with you and control the bleeding and call that dentist. I would try to do it as soon as possible and get that child or even an adult in to see that dentist so that dentist can care for it as soon as possible. It's usually not a dental emergency though, unless or a medical emergency, I should say, to the point of calling 911 unless there's a lot of blood loss. But if we control the bleeding, just take them to the dentist and they can reimplant these teeth with the teeth remaining hydrated until you get there. Thanks a lot for watching, and we hope you stick around to watch the next video too. Bye-bye.